Hi, everyone. I'm Dr. Leana Wen. I'm an emergency physician, the former Baltimore City Health Commissioner, and currently a visiting professor here at the George Washington University Milken School of Public Health. And I'm also here today in my capacity as a distinguished fellow in the Mullan Institute of Health Workforce Equity. I'd like to welcome everyone to the 13th webinar session in the Mullan Institute mini-series on emergency health workforce policies to address COVID-19. I'd like to thank Dr. Polly Pittman, who is the director of the Mullan Institute, and also Dean Lynn Goldman, Dean of the School of Public Health, for their support. Today, we will be discussing the workforce needed specifically for contact tracing. Now, contact tracing is the bread and butter of local public health. We know that when somebody has an active infection, it's necessary to trace their contacts to figure out who they were exposed to during the time that they were actively infectious. Contact tracing is also the key to containing COVID-19 as part of our response to this global pandemic, and therefore is key to safely reopening here in the US and around the world. Now, this is a topic that has many facets, and I'd like to introduce now 3 panelists with me to discuss this further. I'd like to first introduce Dr. Candice Chen, who is an associate professor in the Department of Health Policy and Management, and who is also a principal investigator at the Mullan Institute. Prior to joining the Institute, she was the director of the Division of Medicine and Dentistry in the Bureau of Health Workforce at the Health Resources and Services Administration. We'll also have Dr. Marcus Plescia, who is the Chief Medical Officer in ASTHO, the Association of State and Territorial Health Officials. He has served in public health leadership roles at the state, local, and federal levels, including Director of Chronic Disease for the North Carolina Division of Public Health, the Director of National Cancer Control Programs at the CDC, and County Public Health Director in Charlotte, North Carolina. And we also have with us Mr. Chris Aldridge, who is the Senior Advisor over the Public Health Infrastructure and Systems Portfolio in NACCHO, the National Association of County and City Health Officials. Previously, he served as Assistant Director for the Office of Infectious Disease Prevention and Care Services at the Maryland Department of Health. So I'd like to begin today with Mr. Aldridge, if I may. Chris, can you tell us about how COVID-19 has affected the workload for frontline public health workers?
Well, thank you for having me to talk about this really important issue. So what we've seen is that the workload has really increased dramatically as health departments coordinate with healthcare systems to ensure access to testing, to be able to secure PPE, to provide guidance to the public about how to stay safe, and to conduct contact tracing where that is viable right now, given the caseloads that may be within the community. However, we are seeing some really big challenges that are placing strains on the workforce, particularly given the fact that the workforce has decreased dramatically over the past decade. And so based on some soon to be released data from our 2019 National Profile of Local Health Departments, the local health department workforce experienced a 20% drop between 2008 and 2016. Largely due to Great Recession, and it has not recovered since then. In 2019, the total size of the local health department workforce is still 17% smaller than it was in 2008. So that means that local health departments are trying to do more with fewer staff. And that's really an important factor when planning for and managing the surge in contact tracers that's going to be needed to really reopen the economy back up, reopen society back up, and to really get folks getting back a little bit more towards normal. This is also really important because it means as we redirect workforce resources to address COVID-19, we also don't want to forget about vector-borne illnesses, immunizations, foodborne outbreaks, and other factors and issues that are still arising. And so the more we focus on COVID-19, the more some of the things that health departments do on a day-to-day, we just are not able to focus on those anymore, and that has an impact as well.
Thank you very much. Appreciate the explanation, Chris. So I now want to turn to Dr. Chen to tell us more about the workforce estimator. And specifically, can you take me through some of the important metrics involved to make an estimate? What's the process or ways of thinking when devising approximations for this workforce estimator?
Sure, thank you, Leana. If I could get our slides up, I can show you what the estimator looks like. And I also want to recognize you as well as our dean for really pushing us to build this tool. And I'll tell you the underlying idea behind building this tool was to create something that could help local communities, counties, states, and at the national level plan to be able to do contact tracing. And we know that, you know, as Chris was talking about, the workforce and the people to actually do the work is really going to be critical. And I should also recognize that both NACCHO and ASTHO were really important partners in helping to develop this tool and provided a lot of the expertise that went into what you're seeing right now. And so you're actually looking at our estimator, and what we started with was the contact tracers per population. And through many discussions and through a literature review, we actually set a baseline of 15 contact tracers per 100,000 population. Now that can be changed by the user if they want to look at different baseline contact tracers per population needs. But then we started to recognize different communities, different counties, different states were seeing a lot different numbers of COVID cases. And so we recognize that it's not just the baseline that people might want to target. It is targeting what is actually happening in their own communities. And so we went to the Hopkins data, and we particularly looked at the number of COVID cases in the past 14 days. And we built off of that baseline to say how many contact tracers would you need to be able to effectively address at least your last 14-day of COVID cases. And the estimator will look at it both at a national level as well as down to a state level, county level. And then you can also see that to be able to determine how many contact tracers you need to know a little bit about how many contacts we expect per case. And so at baseline, what we did is we said 10 contacts per new case. And that's what most people will estimate, that with social distancing, that's a reasonable number of contacts. Some people are seeing even less with the with the stay-at-home orders and things like that. But that's really important to remember, because once the stay-at-home orders and the social distancing is starting to relax, the number of contacts per cases is expected to go up as high as 20 or maybe even up to 30, and that'll affect the workload that your contact tracers will have to address. And there are a number of other things. It's the work capacity. It's how many case interviews can a contact tracer do in a day? How many contact notifications can they do? And we recognize that there are a number of things that are going to affect what those numbers look like. For example, communities that have greater social needs, the contact tracing workforce might need to spend more time with them and provide case management. And they might be, not that they're doing less work, but the number of case interviews and the number of contact notifications that they can do in a day, because they're also addressing social services and social needs, might go down. For communities that are starting to uptake the apps and the technology, they might be able to do a little bit more in the course of a day. Now, again, what we did is we set a preset, a baseline, and we went to, again, the experts, Chris, the experts at ASTHO, to really help us determine what's a reasonable baseline. And what you're looking at that is preset into the estimator is basically the contact tracers needed with social distancing and with some social service assessments and case management. Again, those can go up and down, and the estimator will let you change those. Now, if we can actually go to our next slide, if you click on the states, it'll actually take you down to the state level and let you see the counties. And you can see a couple of other features. Those little blue dots that you're seeing, those are your local health departments. And again, that was through the partnership with NACCHO, who provided all of their local health department addresses and the counties that the local health departments take care of. We thought the addition of the local health departments was really important, because that is your local expertise, and those are the places that will most naturally lead local efforts to do contact tracing. And you're looking at Nebraska because that's where my husband's family is. So I always like to look at Nebraska. And if I go to one more slide, what you're seeing is once you click on a county, it'll pull up information on the county. And I don't know if I'm getting cut off a little bit in what I can see, but at the bottom, there's a results panel that will give you a little bit more detail. And the pop-up boxes will also give you things like the demographics of the county. And so if you're trying to determine well, how much social service needs is my community going to need? Some of those demographics are meant to help you with that.
This is really wonderful, Dr. Chen. Thank you so much for demonstrating this and also for creating this tool. I mean, I can certainly see how it would be useful to our fight against COVID-19 and would be useful for health officials all across the country, which brings me now to Dr. Plescia. If you can tell us more about, for your members, why this workforce estimator is important, and how do you think it can be useful to the members that you represent?
This workforce estimator is really important for our memberships and really just for state and local health department leadership in general. And it's not just important for them. This estimator and this issue of contact tracing is really, I think, extremely important for our society and for communities that are trying to reopen now and move out of some of this very restrictive stay-at-home mitigation type of interventions into a different mode where we can bring our economy back. But what everybody has to realize is we cannot do that in a void of not doing other things to control the infection, or COVID will come back in far worse than we've seen it so far. So this is about infection control. This is a very important tool. And this has been useful for us because I think it's really helped to continue to get our membership's attention to this issue. We've really been working with them. There is a lot going on in public health right now with the COVID outbreak. And there's all kinds of priorities that are competing for our membership, the public health leaders' attention. And this has really helped them get focused on contact tracing and how important these core infection control components are going to be in order to pull away and to get COVID under control and win the battle, as you so nicely alluded to just now, Leana. So, we think it's going to be helpful for them as far as planning and prioritizing. It also gives some context. I like the fact that when we started out doing this work, we had some very raw numbers, 100,000 people need to be hired across the United States. We needed to get a lot more context than that. What does that mean for this state or that? What does that mean for individual communities? Most of this work really gets done at the community level. So it's extremely helpful. It's a fantastic tool. We're really pleased to be able to be part of it.
And we think one interesting part of it too is how much it could be tailored for local needs, which is really interesting. Another part that I know people might wonder about and look at this estimator is how it could fill in temporary need as compared to long-term benefits as well. I mean, one can imagine that contact tracers might be needed for a significant period of time, given that this pandemic is ongoing, but how might you think about the long-term use for it too?
Yeah, one of the really useful things about the tool is that it gets at this issue that we hear a lot of, well, hiring this many people in a short period of time, is that realistic? And I think the tool starts to show how it is realistic because, first of all, it breaks it down. We're not going out and trying to find thousands of highly trained public health epidemiologists. We're trying to find a mixed workforce, and the tool nicely breaks down the different roles and functions. And some of those core frontline functions, there are a lot of people out there who can do that work with some basic training. Not everybody can, but there are a lot of people we can bring in. And that's what makes it more realistic when you see it broken down and you understand the different sectors we're going to go to and the different kind of roles and what the numbers are for those roles. Then you start to see how, well, yeah, we probably could pull together this capacity. And let's be clear, we know how to do contact tracing in state and local health departments. We've been doing it for decades. What we're talking about here is taking it to scale. And I think this tool helps take it to scale. Now, in the long term, what's really important and what this tool really points up is that, the kind of scale we need for COVID hopefully is going to be a little unusual. But we've been seeing, significant reductions in capacity in state and local health departments due to budget cuts for decades now. And I think this tool helps us get back to a level to fight COVID, but ultimately then back to a steady state level where we can be much more effective in the work that we do.
Oh, that makes a lot of sense. And I want to turn back to Mr. Aldridge, if I may, to give us some more context from your perspective too about why it's important to see the local health departments on the map. And if you can also talk about why it's important for people to be able to adjust the parameters themselves based on that local context.
Mhm. Well, one of the things is I think it's really, in this approach to scaling up contact tracing and in the overall fight against COVID-19, this has really been a joint effort between the local health departments and the state health departments working together under the guidance and the support of the federal government to be able to really make sure that we're having an impact. But one of the things about local health departments is really they are kind of on the front lines and the closest to the communities that they are actually serving. So I think that's one of the reasons why it's really important to be able to see the local health department on the map and to really sort of communicate that, and for folks that are using this tool to be able to know this is the local health department that is covering this catchment area, this number of counties. And it helps us in terms of to think about these estimates in terms of what it means for the entirety of that local health department, which sometimes can cover multiple counties. So I think that's one of the things that's really powerful about the tool is it does let us get down to that local level and really see that impact with the local health department. And one of the great things about being able to sort of change some of these parameters, I think the sort of those basic parameters that when you go in that it allows you to do the calculations are really good. And it's based upon a lot of data we've gathered about what makes sense. But while there is really a common approach and basically all the health departments kind of do the same way, kind of are doing contact tracing very similar, gathering the same sort of information, making the same recommendations for folks, but how they ultimately divide up that work may actually vary from health department to health department. And so it could mean we need more of one type of staff, less of another in one health department, and then it changes for the next health department, depending on how they want to divide up that work and how they want to make it make sense for them given their workforce capacity. So by being able to change those parameters, it really lets us get the best estimate possible for the number of contact tracers that we will need for that local health department. It also is helpful because we can change sort of those caseload numbers and really make some estimates and think about not just what's happening right now today, but what do we think our caseloads are going to look like in the future? And then how do we then estimate the needs for contact tracers at that point in time? So that really helps us really change our estimates based on how cases may be rising or how they may be falling.
So if I can come back to Dr. Chen to get into more detail about the tool itself, I'm wondering, as you were coming up with the tool, can you talk about some of the assumptions that you made, and also about whether any of these could be controversial or whether they were surprising to you in the process of devising them?
As I talked about a little bit before, when we finally set those preset numbers, recognizing that people can and should change them around and test different assumptions and test different models of how their local contact tracing teams might work, I think one of the things that really did strike us is that the contact tracing and particularly being thoughtful about being able to, I'd say, elicit, develop trust, address social service needs, and then do the follow-up as needed, for people to actually be able to stay at home. Some people are going to need social service support, and that is going to add time to what contact tracers can do, and how many cases and how many contacts they can complete in the course of a day. And so, that really stood out to me as we started to, work out which were the preset numbers that we really, really wanted to have. This isn't quite the question you asked me, but one other thing that did stand out to me was the idea of, if we're hiring new contact tracers, that at the local health, I do believe that at the local health department, many local health departments are absolutely the right place to lead, to manage this work. They are the experts on the ground. Working with NACCHO, they did point out that a lot of the local health departments are relatively small. I think that there's something over like 400 local health departments that are serving communities of less than 10,000 and have less than 4 FTE. And so it does mean that we have to be thinking at state level as well. We have to be thinking at national level as well. There's going to be a lot of different strategies for how we do this. But in hiring and recruiting local contact tracers, one of the things that also really did strike me is the need to support those local contact tracers and to think about things like this is employment for local communities. And if you're going to recruit people from local communities who are probably, you know, if you think about like the community health worker model, right? Local recruitment is probably going to be the most effective in terms of underlying trust, in terms of being able to do the education, in terms of being able to provide the social services support. But we also want to make sure that we're supporting the recruitment in a way that is equitable for communities, because these are going to be jobs for communities as well. And that's really important to kind of keep in mind.
That's such an important point. Thank you for bringing it up. And actually, it brings me to a question for Mr. Aldridge, about how that might work on the local level. I mean, can you give us an idea of, now that we have these estimates of what's needed, how will local health departments then take that information and go about doing that recruitment for the numbers that are needed, and in a way, as Candice just mentioned too, to get those trusted messengers from the communities that they're serving?
Mm-hmm. Well, definitely I mean, between NACCHO and ASTHO and others, we definitely have ways to start getting out and promoting and to letting folks know that these are jobs and positions that are definitely available within the community. And so to really do that work, to be able to start actively recruiting. But one of the things that's also really powerful about this tool is that also, as we look at sort of the numbers of folks that we may need, it also helps us think through too, what are the IT needs, what are sort of HR needs and other things that supervisor needs that we need to do, training that we have to put in place to make sure that this is a workforce that's actually ready to get on board and be able to get out there quickly and really move forward. So I really think, so this really provides an opportunity for health departments to begin to think through that and to really make sure that they're setting up their system so they can begin to onboard what is really a significant number of folks at the same time. And so they can really get them, you know, on board and ready to go. They're also going to really depend on perhaps some of the partners in the communities, universities, other, you know, healthcare settings that maybe have some excess capacity to be able to come in and help support these efforts. And a lot of health departments have medical reserve corps that work with them, that actually recruit a lot of these volunteers from the community to be able to go out and to be able to help support these efforts as well. So there's a lot of different ways I think the local health departments are going to work to be able to go ahead and really scale up this capacity in a very quick amount of time. And again, they're going to depend upon the support of the state health departments as well to support them in this.
And speaking of which, if I can ask Dr. Plescia to just talk a bit, because you have had such extensive experience on the local, county, state, and federal levels. So if Marcus, if you can just lead us through some idea of how that coordination works, and specifically how it might work in coordinating getting the level of contact tracers that are needed. And of course, we know that contact tracing doesn't occur in a vacuum, that we also need additional testing, we also need quarantining, isolation capabilities. How might that all fit together, and what would that coordination look like?
Yeah, you know, coordination of public health services, it does work a little bit differently depending on when you are. Different states have different models and approaches. They have different ways of working with the local communities that are where most of the contact tracing is going on. You know, our first perspective on this is that, you know, the COVID outbreak, infection control, contact tracing, I mean, the initial thing that we saw is a real need for leadership. We really needed public health leaders to get behind this, to, you know, they were very distracted with what was going on at the moment, and we needed them to kind of start thinking ahead a little bit and start trying to prepare for what we needed to ultimately do to change up what's going on with the epidemic and maybe finally get one step ahead. Now, I think that the way that that plays out as far as the state and local level is going to vary. You know, when I was the health director in Charlotte, North Carolina, you know, anytime we had a big issue going on, we would go to the state and work with the state. In some ways, the state was a surge capacity for us. We could bring in additional technical assistance if we needed. Sometimes we could even bring people in from the state to help us. Other times the state might help move people around and provide some resources from another county. And so, you know, that's my experience with how it's worked, but I think it works differently in different places. You know, ultimately, a lot of this work occurs at the community level, and particularly when you get beyond the actual contact tracing to some of the wraparound services, some of the stuff that makes contact tracing work. You know, we're asking a lot of the public. We're asking them to tell us about their recent movements if they've become ill, and we're trying to determine their contacts. And then we're going to those contacts and we're asking them to quarantine, to stay at home for a period of time until we make sure they don't get sick. We've got to make it easy for them to do that. And that's where some of the wraparound services, that in some ways maybe even the harder part, to put in those kinds of services and that kind of infrastructure so that people can stay at home and they have the things they need while they're doing that.
I think this is why the perspective of those of us who've had that local on the ground experience is so important, because otherwise we seem to be talking about things in a vacuum. It's not just that, it's not so clinical as you talk to somebody, figure out their contacts, call them, and we're done. That just as we know in clinical medicine as well, that so much else goes into a person's life that also needs to be tended to as well. So I'm going to ask all the panelists a concluding question. In this time of this pandemic, sometimes it feels like we're overwhelmed with bad news. And there's, of course, a lot of uncertainty and fear in what we're going through. But I also think there's a lot of hope. And I'd like to ask everyone for what gives you hope, and if there is anything that you would be also hoping for as we proceed in the next step of this pandemic. And I'm going to start with Dr. Chen.
Sure. Thank you so much, Leana, for moderating this session too. I have to say, working on this and building the contact tracer and getting the opportunity to work with people like Chris and people like Marcus and others at ASTHO, and being able to talk to local county public health leaders, I think what gives me hope is the expertise and the public health leadership that exists. And it makes me believe that we can do this. And we just have to keep supporting, keep educating, and keep doing this work. But working specifically on building this estimator gave me a lot of hope and a lot of just faith that the expertise and the people that we need to really be successful and to save lives is out there. Now we just need to support them.
Fantastic. I want to turn to Chris also to give us your perspective about hope.
So I think one of the things that really has given me hope, and I think has been really great to see with this, is that we've seen so many, be it universities like George Washington University, big tech companies, consulting firms, other folks that have come forward where this is not necessarily their field, but they really are saying that, hey, we have expertise that could be valuable. We can build tools for you. We can help you. We want to support you in this work. You know, no charge. You know, we have a workforce here. We have capacity here to help make a difference. And that is one of the things that I feel like has really given me hope with this, because from all across different fields, folks are really coming together and really trying to make a difference, and particularly to support and to value public health and the role of public health in fighting COVID-19. So I think that's one of the things that has really given me hope. The big thing that I hope we take away from this is to make sure that the lessons that we learn and that the infrastructure needs, making sure that we are prepared for the next time something like this arises. And that's always the key thing, is always to make sure that as the years go on and maybe we don't experience something like this again, it's very easy to let your guard down. And so one of the things I want to make sure is maybe this time we don't let our guard down and we keep investing in public health infrastructure and the public health workforce. So the next time something like this does arise, we are better prepared, and we can even reduce the number of folks that may be impacted or die from a particular outbreak.
I think all of us in public health are so sensitive to the fact that our work is invisible until something bad happens. And so I very much appreciate your call to action for us to make our work visible, and to look at preparedness as a necessity. So last but certainly not least, I'm going to turn to Dr. Plescia.
Well, I too have a lot of hope, and much of it is because I've been part of the public health workforce in multiple areas for a while now, and I believe we have the capacity and the people and the skills out there to make this happen. But the thing that I am really hopeful about is I am hopeful that we are now at a place to get one step ahead. We have been one step, it has been so frustrating to feel like we are one step behind in this epidemic from the get-go. You know, we can't test people, we can't protect our healthcare workers. It's just one thing after the other. Now that we're segueing into this area where we can do infection control, we know how to do infection control. We now have tools like this and trainings that are being developed to really scale up our workforce and do it. This is the opportunity, and I have a lot of hope now that we're going to get from being a step behind to actually being a step ahead, and that's going to be good for everybody.
Well, that indeed is a very hopeful message for us all. I'd like to thank everyone for joining us today, and certainly to thank our panelists, Dr. Candice Chen, Dr. Marcus Plescia, and Mr. Chris Aldridge for joining us on this session. I hope that everyone who's watching and listening will now be able to use the data tool to calculate contact tracer workforce need. And you also can see in this presentation about why the work of public health is so critical. So to everyone in the audience, we hope that you have a wonderful afternoon, stay safe, and thank you once again.